Hi, hello. Good afternoon. How are you? Good?
Yeah.
Okay, you can hear me and you can see me well?
Yeah.
All right, perfect. So now I'm going to unmute all, okay? I'm going to start my talk. Enjoy. I hope that you will learn something new.
Inshallah.
Okay. So, 1 second. Okay, so this is my clinic. This is Dubai Herbal and Treatment Center. I am working there for 3 years, okay? And it's a combination between alternative medicine and conventional medicine. It's in an holistic way. So I am running the department of physio and nutrition, okay? So a little of my background, I hold a bachelor degree in physiotherapy and nursing, okay, and I have a master degree in osteopathy and clinical and sport nutrition. So I have 13 years of experience, and I have so many postgraduate courses. I am Pilates instructor. 1 second. I am Pilates instructor. I am scoliosis with the Scrot method instructor. I am specialist in lymphatic drainage massage, and I have also courses about neuromodulation. So always I try to keep updated because I would like to offer the best to my patients. All right, so the talk, I want to talk about the chronic musculoskeletal pain and the relation, 1 second, because I need to record, I think it's recording, yes. About the chronic musculoskeletal pain and the relation with the mobility exercise, okay? From the theory to the practice. Okay. Everything is okay? All right. So, first of all, what is pain? So, as per the International Association for the Study of the Pain, it defines pain as an unpleasant sensory and emotional experience associated with the actual potential tissue damage. So, pain is not just a physical sensation. There are so many factors involved. So, for example, imagine if I press here in my elbow with the same intensity that I am pressing your elbow. So you will feel a different experience of pain, okay? And during this talk, I will try to explain that. So there are two main categories of pain. One is acute. 1 second, I'm going to, please mute, okay? 1 second. Participants, I'm going to unmute all. Sorry for that. All right. So there are two kinds of pain. One is acute pain, so lasts for a short time and occurs following a surgery, trauma, or another condition. And the third is the chronic pain that lasts beyond the time expected for the healing following surgery, trauma, or another condition. So at least it will be 1 month or 3 months in a persistent or repetitive way. We focus in that, in the chronic pain. So, as per World Health Organization, the chronic pain is affecting 20 and 30% of the worldwide. So imagine how many people are suffering about this kind of pain. So for us, physios and nutritionists, is a huge challenge. And we need to treat them in a biopsychosocial model that later on I want to explain that. And also evidence say that exercise can mitigate this kind of pain. So after, at the end of this talk, I will provide you what is the etiology. Etiology means what is the cause of this kind of chronic musculoskeletal pain, and after we'll have around 20 minutes to learn which kind of mobility exercise can mitigate this kind of pain. So as I told you before, we have to treat the patient in a biopsychosocial model. So what does mean that? It means that the chronic musculoskeletal pain is in relation with, there are so many factors, but like I don't have so many time, I will resume in 3 factors. The first, it will be the central and peripheral pain mechanisms. The second, immune system, and the third factor, affective aspect of the pain. So the first one, the first cause that can provoke, or one of the causes that can provoke this chronic pain is the mechanisms of the central and peripheral sensitization. So in this picture, I will try to explain you. So in this picture, imagine with the mouse, okay, you fall down and you hurt your knee. So in your knee, you have nociceptive receptors. Nociceptive receptors are painful receptor, okay? And this painful, or this information of the pain, is running through neurons to your spinal cord. It will be the posterior cord. Anyway, it's reaching your spinal cord. And from your spinal cord, through ascending pathways, it will go to your brain. And your brain, it will receive that sensation and will say, okay, you have pain. And after that, the inflammatory process, it will start, and your immune system, it will react. This is the acute pain. But we will talk about the chronic. What it will happen in the chronic pain? So, in your muscle, in your knee joint, okay, imagine that you have a hypersensitization of the pain, overstimulation. And it means this pain, it will be prolonged in the time. So you will have a chronic pain, right? Okay. So another cause that can be related or can provoke your chronic muscle pain is your low immune system. And these days, everyone knows, because of this corona, that our immune system is low. So these kind of people, they have a low grade of inflammation stage. It means that inflammatory stage could be provoked with so many things. Like, for example, if we are exposed to microbial cell wall garments, or we are exposed to toxins, or irritant chemicals, or autoimmune reactions. All right? Okay. So, always I am telling to my patient, 80% of our autoimmune system, our immune system is in the gut. To have a healthy gut is really, really important. And also, we have a gut-brain axis. What does mean that? So all the things are, this axis is very related. It means something happens in your gut, it will affect your brain, and vice versa. That's why really, really important to take care of our gut. Which kind of factors can affect this unbalance? Where are our bacteria in the gut? Like Sandra talked in the last day, eating habits, very, very important, okay? And it's not just about the junk food. We have to give guidelines as nutrition to the patient, which kind of food, anti-inflammatory food, they should take, all right? Okay. Physical, another factor that can be involved is the physical activity. Really, really important to be active. Okay, it's true that Dubai, the people say, oh no, but there is too much hot, I cannot. Always, there is a way to do physical activity. When you are going to the supermarket, please park far away. Instead to use the elevator, please use the stairs. Simple things. But apart of this, apart to be active, we need to do physical activity. First, strength. Really, really important to increase your muscle mass. There are so many metabolisms routes that are related with the muscle mass. Do cardio and mobility exercise. Today you will learn about this mobility exercise, okay? Sleeping quality, so important. Management, stress management, and vitamin D. In Dubai, most of my patients, they have vitamin D deficit, and it's because we are not exposed to the sun. It's a sunny country, but we are not exposed. So the vitamin D, it will be from this, first it will be from the sun and from the food. But it's very, very important to check what are the levels of vitamin D, because it's very related with your immune system. All right, and the third cause that can provoke, one second, okay. So the third cause that can provoke your chronic musculoskeletal pain, it will be the affect aspect. It means that there are people that they have negative emotional states, or they have anxiety. These days, so many people, stress, depression. So all that can be related with our chronic musculoskeletal pain. Right? So right now, I would like to ask you one. You have the answer already, but reaching that point, I can say that the chronic musculoskeletal pain is a source of painful input directly linked with the pain expression. Obviously, no. There are so many factors involved, right? So now we can say that our chronic pain doesn't always provide a measure of the stage of the tissue pathology, because there are so many factors that can modulate this kind of pain. So as physiotherapy and nutritionist, how I can modulate this painful or this pain input in the management of the musculoskeletal disorder. So I have to treat, obviously, with manual therapy. For example, if a patient is coming with chronic shoulder pain, I have to reduce the stiffness, improve the mobility, reduce the tightness. First, in a passive way, it means I will help the patient to do it, and after that, I have to modulate working with the nervous system through active movement, right? Also, I have to provide the patient an eating habits, eating guidelines, right? And after, I have to prescribe to the patient to do mobility exercise to involve all that information that I give to the nervous system, and they have to work. They have to work by themselves. We are doing Pilates session in the clinic, and also they have to do at home. It's called mobility exercise. So we are reaching the end. With this mobility session, what you will improve, or what the patient with chronic pain, they will improve, or what you will improve. So you will improve your range of motion. You will have a body-mind perception. It means you have to be focused in the movement of your joints, in the movement of your body. Okay, you need to involve your nervous system. You will feel more confidence, and you will improve the posture. It's really important to keep a good posture. In Pilates, I am working a lot with that. You will improve your breathing, a diaphragmatic breathing. Breathing properly, it will improve your immune system, it will activate the blood circulation, and it will reduce your stress, okay? So important while we are doing any kind of physical activity to breathe in. Please breathe. There are so many pathologies that comes because lack of breathing. With this exercise also, with this mobility exercise, will boost your immune system, will improve your bowel motility, will reduce the stress level, and will increase the energy and good mood. So everything is perfect. And a part of that, if I add my body weight, will improve our techniques and we'll get strength. All right? So, question and answers. Anyone has any question? No? All right, so now what we'll do? So now I will start with our mobility session, okay? So we have around 20 minutes, okay? And we'll do it. So everyone has the mat ready? I hope, okay? So please, lie down in your mat, facing up, okay? And we'll start, I want to teach you how it will be the breathing, the diaphragmatic breathing. So I will put my hands in the lower part of the lower ribs. Okay, so I have to breathe in with the nose, breathe out with your mouth. All right, and be careful about your posture. So look my lumbar. My lumbar has to be flat. Okay, has to be touching the floor. So breathe in through your nose and exhale through your mouth. Again, breathe in and exhale through your mouth. Again, breathe in, we'll do 5. Exhale through your mouth. 2 more. Breathe in, breathe out. 1 more. Breathe in and breathe out. Okay? Alright, so all the exercises that we'll do will work with the breathing. So now we'll do the bridge. So breathe in through your mouth, inflate your tummy, and exhale, squeeze your glutes and going up. It's an easy one, but feel the mobility of your body. Breathe in, go down, and exhale. Breathe in, go down, and exhale. Again, breathe in, exhale. 2 more, breathe in, exhale. Feel your movement, feel the breathing. 1 more, breathe in, and exhale, squeeze your glutes up. Alright? Okay, we'll do, these are sample exercises that you can do at home. The second one, it will be inhale, arch, we call it pelvic tilt. Okay, so breathe in, arch your lumbar, exhale, push back. Okay, so feel the movement of your pelvic tilt. Inhale, arch, exhale, push back. Okay, careful with your shoulders, chin down. Breathe in, exhale, push back. 2 more. Breathe in, exhale, push back. 1 more. Breathe in, inhale, and exhale, push back. Okay? Pelvic tilt down. Very good. So now, I realize that so many people that are coming to my clinic, okay, they have a lack of mobility of the hip. It's really important to improve. So, we need to breathe in and breathe out and pull out, okay? So, breathe in, try and compensate, try and shift your hip. Exhale, open like that, right? So, breathe in, you need to feel the movement of your hip, highs opening there. 3 more, breathe in, exhale. Breathe in, exhale. 2 more, breathe in, exhale. 1 more, breathe in, and exhale. Alright? Very good. Now I change. 5 times, breathe in, exhale, open. Breathe in, exhale. Breathe in. 2 more, breathe in. Again, breathe in, exhale. Breathe in through the nose and exhale through the nose. Good? Alright. So now we'll move your shoulder blade. So you will start from here, and while the exhalation, you have to go all the way up. But again, don't arch. We have to work in neutral position of your pelvic. It means your lumbar has to touch the floor. Alright? So breathe in and exhale. And as much as you can, go higher. In my case, I can touch the floor. But some people can reach until here. Don't worry. you will improve, okay? But do properly, don't arch your lumbar. So breathe in, and while the exhalation, I go up. Breathe in with your diaphragm, and exhale. Breathe in, exhale. 3 more, breathe in. Look my tummy, look my diaphragm, heart movement. 2 more, breathe in. Up here, exhale. 1 more, feel the cracking in your back, I am feeling. Exhale. 1 more, breathe in. And exhale. And relax. Okay? Good. So now I want to stretch my back side of my leg. So from 90 degrees, you will breathe in, and while the exhalation, as much as you can, try to reach the vertical. If you are reaching until here, don't worry, okay? You will improve. But keep flat your lumbar. So breathe in and exhale, stretch up, toes to you. You will feel all the back side, right? Breathe in, diaphragm, exhale. Feel the stretching as much as you can. Breathe in. This is a neurodynamic technique also. We are working always with your nervous system. It's not just mobility, it's involved your nervous. Again, breathe in. Try also the chin, try to go down with your chin, okay, to elongate more the neural part. You will feel all the elongation. Exhale. 3 more. Exhale. 1 more. Breathe in. Okay? Very good. I change. 90 degrees. Breathe in. And exhale. Feel the elongation. In my case, I am feeling more in this leg. Okay? We are not perfect. We are not symmetric. It means always you will have more, one part more tense. Breathe in. Exhale. Toes to you, heel up. Careful with your shoulder. Keep flat. Breathe in. Again, breathe in. We have still a few minutes. Again, breathe in. Exhale. 2 more. Breathe in. 1 more. Breathe in. And feel the elongation. Okay? Very good. So now look. I lay down on my side. I keep in fetal position, okay? I extend my elbows, and from here, I will twist my spine. So, the twisting point, it will be where is the bra, the thoracic part, the middle part, okay? So, you will start from here, and you will twist. Be careful, okay? Don't to move your hip. Has to be straight, okay? We have to dissociate. That's what it means to twist. So, breathe in. And look your hand all the time and feel the middle back. This exercise is very important. Most of the people, they spend a lot of time sitting in front of the computer. They become so stiff. And this rotation, they cannot do it. Exhale, twist, 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 twist. Be careful because it's not a shoulder movement, it's a thoracic movement. So try to twist from your spine. Don't pull from your shoulder. Okay? Breathe in, exhale. As much as you can. Not necessarily you have to touch the floor. I am touching because I am a little more flexible probably than you. Twist. 2 more. Breathe in, exhale. One more. Breathe in. And exhale, twist, 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 twist. And relax. Okay? Very good. I change. I lay down on my right side. Okay? There are simple exercises, but probably you will forget. So after, okay, breathe in, exhale, and twist to your left. So we'll put in our way. And you can down anytime. Breathe in, exhale, twist, twist, twist from your middle back. Okay? Be focused in the movement. Okay? I explained you already all the factors. Exhale, twist, try don't shift, try don't move your pelvic. 3 more. Breathe in through the nose. I exhale. I look my hand. I twist. Again, breathe in. Exhale. 3 more. Breathe in through your nose. Exhale. Breathe in. And exhale. Go, twist, twist, twist from your middle back. And relax. Okay? Good? Alright, so now look, I will work with my hip mobility. So now I will try to sit like that, okay? There are people, most of my patients that they are coming, they are not able to do this kind of exercise, but it's just to let you know in which level of mobility are you. So you will sit with one leg forward and the other backward, okay? And try to keep alignment. Imagine that you have a cable pulling you up. So this is incorrect, has to be straight, okay? And from there, imagine that you have a ball between your hands and you will flex forward, okay? But I will not flex, carrying my back. I have to keep it straight. So I will improve my hip mobility going forward and backward, okay? So again, exhale, breathe in, exhale. Imagine that you have a tie here and you need to move forward, right? Again, breathe in, keep it straight, exhale. Breathe in, exhale. More, breathe in, exhale. One more, breathe in, and exhale, feel here. And also you have to feel here in your glutes, right? Very good. I change. Leg forward, leg backward. I feel my cable. Okay, chin, if you can put double chin, better. And breathe in and exhale and feel the stretching in your left glutes. Breathe in, exhale. Again, breathe in, exhale. 3 more, breathe in, exhale. 2 more, breathe in. And the last one, breathe in, and then forward. Okay? Good? Let's go. Another one. I hope that you enjoy. So, the typical cat and cow, okay? So, it will be here, from here, and I arch. So, here you have to arch your lumbar, and here you have to go up. Okay? So, breathe in, chin up, okay? And while exhalation, breathe in, relax yourself, feel the movement. Breathe in, try to improve your range of motion, go farther. Exhale. 3 more. Breathe in. Exhale. 2 more. Breathe in. Exhale. 3 more. Breathe in. Exhale. 2 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 more. One more. Breathe in and exhale. Okay? Very good. Now, we'll do 1 second. Okay, so now we'll do the Superman. So the Superman, it will be try to keep straight your lumbar. You will touch contralateral hand. So for example, I will extend left hand, right leg, okay? So I will breathe in and while the exhalation, I will extend. So here, I am activating my core and of course my nervous system, okay? Breathe in, I am improving also the balance. Breathe in and exhale, extend. Breathe in, exhale. Breathe in, exhale. 2 more. Breathe in, exhale. 1 more. Breathe in and exhale. Okay? I change. Right hand, left leg. Breathe in and try to keep it straight my lumbar. Don't drop here. Keep it straight. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Exhale. Extend as much as you can. Go higher. Breathe into the horizontal. Extend. 2 more. Exhale. 1 more. Breathe in. And exhale. Okay? 1 more. Alright, so now I will stand up. Okay? And I will work coordination. 1 second, the coordination. So, I need to, right, here. So now look, I open here and I close. I open, core stability, field extension, and I close. Okay? Breathe in and close. Breathe in and close. Breathe in and close. Breathe in and close. 1 more. Breathe in and close. Okay? Good. The other diagonal. Right hand, left leg. Exhale. Breathe in. Exhale. Breathe in. Exhale. Breathe in. Almost finished. 3 more. Breathe in. Breathe in. Exhale. With your core stability, your balance. And the last one. And exhale. Okay, guys? So this is a basic example of the exercise that I prescribe to my patient. Obviously, I have to do more exercise with them. Okay? So I hope that you enjoy. Please let me know if you have any doubt, any question.
Elena?
Yes.
It's Dr. Travis. Thank you very much. What a wonderful demonstration. You move way better than I move, so I've got a lot of work to do. So I'm glad that you weren't seeing me. Question that I have my own answer for it, but I think it's worthwhile discussing it for everyone else on the call. Is number one, why should we be breathing as consciously as what you were making us breathe while we're moving? So that's question number one. And question number two is, why should we be breathing in at a certain point and breathing out at a certain point?
Okay, so the breathing is so important. The diaphragmatic breathing is so important to release the stress that you have, to improve the muscle activation, to improve the blood circulation. All right, and also it will improve your immune system. So all the exercise, you need to breathe in. If you are breathing in one way, in another way, no focus in that, but breathing. Okay?
Thank you very much.
Welcome. Hope that I answer well.
Elena?
You did.
Yes. Yes, Sandra?
Okay, thank you for your talk today and show us how we can modulate the pain only from a specific injury. And I agree with you that when we focus on pain, we need to see at the few factors can affect to our lifestyle as human. So it's very important for our patient and to educate our patient that, as you said in your talk, okay, not only focusing on injury as well as focusing how is the rest of the factors, okay, to modulate the pain and can affect to our nervous system and specifically to our brain is the one who will send the pain signal. So factors that you mentioned, vitamin D, sleep well, stress, physical activity, mobility, definitely there are factors we need to pay attention when we treat with any patient and any pain management. So thank you for that. And on our hand of physio, one of the best solutions we have is the mobility exercise, mobility range of motion, because we are humans and we are made for that. So don't forget, people, if we want to have a wellness, well-being, we need to move, we need to stay away from the restriction of our movement. So thank you for your talk, and for me it's very clear, and I hope the rest of the people enjoy as well. Thank you.
Thank you, Sandra. I have an excellent colleague. More questions, please. Okay, guys, I don't think there is more. So thank you so much for attending me. Hope that it will be clear. Hope that you enjoy my talk. And I hope that you have a little more information. What are the factors that can provoke this kind of pain? So please move. Movement is life. I hope that you enjoy. Thank you.
Thank you, Sandra. Thank you. Thank you, Elena.
No worries. Thank you.
Thank you, Elena.
Thank you, Elena. Have a good day.
Thank you.